Okay, let's talk about what we're going to do to try to take care of these graphs now. There's a little bit of information to go over, but you don't have to memorize everything that's on this video. You are going to get a pamphlet similar to this here at the end of the day with all the information that you need for the following days and weeks to come in order to take care of those graphs. Also, you'll find Dr. McDonald's cell number here as well. So if there's any concerns, you always have access to Dr. McDonald as well. At the end of the day, you're going to get a little bag like this, kind of your kit here. And in that bag, you're going to find something like a spray here with saline. You're also going to find a headband similar to this and a hat here like this. Also, some blue pads for you to rest your head and keep the pillows clean or wherever you're going to rest your head. Another thing that you'll find in your kit are some medications. You will have something for pain. Typically, we'll give you a Tylenol 3. You will also find something for an antibiotic. Typically, it's Keflex, and also an anti-inflammatory such as prednisone. Now, there may be issues in terms of allergies, but we'll adjust that as we go along as it pertains to each individual. But that's typically what you can find in terms of your medication kit. Now, there may be some discomfort tonight, but because you did an FUE procedure, it's really, really manageable. In fact, most people that do an FUE procedure, they don't really need any pain medication. However, we will give you some just in case so that you can be more comfortable. Now, tonight, what we want you to do for the grafts here is with the spray that you have here, I want you to spray the grafted area. So you don't need to drench it, just a few spritz, and that should be good. And if you can do that about every hour tonight, fantastic. Tomorrow, what we want you to do is continue spraying it, but if you could do that every 2 hours, and that will help keep that area nice and clean and much easier for you to clean it well once you're able to scrub down the road here in a few days. Now you're going to notice some swelling, especially if we've worked on the hairline here. That's normal, but what we don't want is that fluid to fall in between your eyes here, which could cause black eyes. It could cause your eyes to close shut. It is very rare, but it's best to try to avoid it as much as possible. One of the things that you can do to avoid that is massaging, but you have to be very, very vigorous because if you're just massaging the surface, you're not really doing anything. That fluid is underneath the tissue, so we have to really push hard to get that out. So what we can do is start in the center here, and I'm going to push forward with my head, and I'm going to push back with my fingers as hard as I can. I'm even going to grit my teeth here. So starting in the center here, and I'm going to start up and out, making a T, up and out. And you can see how hard I'm pushing here to get that fluid all the way out as much as I can. Now, one thing that you have to be very careful of is not to go up and accidentally dislodge those grafts. So you have to be very, very careful. Staying about 2 finger lengths away from that area and you should be okay. Sometimes doing it in front of the mirror so that you know where everything is even better. So doing it like so, and as often as you can will help avoid a lot of that swelling and a lot of other issues that come with that fluid. Now, one other thing that you can do for swelling is to use the headband here that you'll have in your kit. What this also has is got some of that powder here. So if you can just kind of spread it out evenly throughout and then put this under water, wait about a minute or so, and it turns into an ice pack. So you can have some of that icing here as well. The main thing though is to have some of that pressure just over the eyebrows here so that you can keep that fluid up and above the eyebrows. So in combination with the massaging and with this, you should have no issues with fluid coming down into your eyes. Now in the back, probably going to take 24 hours to maybe 36 hours for those areas to close up. But if you want to lay down flat or 45 degrees, whichever is more comfortable for you, you can do so without any worry about damaging anything in the back. Now we'll give you some of those blue pads that we talked about earlier so you can keep that area clean, but you may notice that you probably still have a little bit of bleeding in that donor area. Again, it's normal, but it will take some time for that to heal up. Okay, we will ask you to be very, very careful tonight when you're getting in and out of the vehicle. For some reason, it's really difficult to judge distance with all the medication and it being a long day for you. So when you're getting in the car, I would recommend you have your hand on that door frame and really exaggerate getting in. Same thing when you're getting out of the car, hand on the door frame and really exaggerate getting out so that you don't bump your head or worse, rub it and pull off all the grafts in the vehicle. So take that extra caution. Also, when you're at home, opening cupboards, Really, really, really watch out that you're not going to hit your head on that as well. Now, we will ask you to take it easy for the next little while here. We don't want your blood pressure to drastically increase because that could cause some bleeding. And if that does happen, it could push some of those grafts out. So if you can take it easy from avoiding any real strenuous exercise, a brisk walk or something like that is okay. But again, we just don't want your blood pressure to increase drastically. Your best time frame would be 10 days. For that time, you're good to go in terms of haircut, back to your normal exercise routines, your normal washing routine. By that time, you've had more than enough time to sort of heal up and get everything back in order. So 10 days is your best time frame to go back to normal.